Thanks to everyone getting behind level 5. We've the lowest 7-day incident rate in Europe. We've the lowest 14-day incident rate in Europe. We've had one of the biggest falls in COVID fatalities between wave 1 and wave 2 anywhere in the world. Huge credit to everyone in the country for getting behind the public health advice. And now on top of that, last week we had the prioritisation plan. And today I brought a memo to Cabinet seeking authorisation for the over €112 million that you talked about, and for the implementation plan and the strategy for the vaccination. So obviously what everyone wants to know is when. When can we get it? When can we put this awful virus and this very tough period in our history behind us? We had some interesting news today. So just after we left Cabinet, the European Medicines Agency announced that they may be bringing forward their decision on the first vaccine, the Pfizer vaccine.
So on Monday. To Monday.
Yeah, right. So what we could have is by the 22nd or the 23rd, we could have an announcement. We were expecting that around the 29th. Now, the implementation plan is such that once the European Medicines Agency authorise it and we get agreement from the European Commission, our experts then do the translation of a lot of the technical detail here, and within a short number of days, we think between, say, 7 and 10 days, we could be vaccinating. What that could mean, which would be a wonderful way to end the year, is that by the end of December, it would be in the last few days, or maybe on the first few days of the new year, we'd be vaccinating. Now, the experts were at pains to say to me today, when I was asking exactly these questions, that the initial quantities would be low. But isn't it a great piece of news to start?
Sure. So the plan is to start with the most vulnerable, and those are people in long-term care over 65 and the people that are caring for them, frontline healthcare workers who suffered grievously in the first wave. How many people is that, and how long will it take to do that?
Well, so the issue more is around how quickly can we get the vaccine. So we have an implementation plan in place. We have a highly professional and dedicated healthcare workforce. So as we get quantities of the vaccine through, we can vaccinate people. So what are we doing to begin with? The company themselves, so Pfizer in the first instance, they're responsible for getting the vaccinations from Belgium over to us. We'll have storage facilities around the country, and then we take over and we'll get it out to large-scale hospitals and then out to the nursing homes. And obviously, the patient-facing healthcare workers will be vaccinated at the same time. That will happen as quickly as we get the vaccine. Now, Ireland and no other country yet has agreed quantities from Pfizer for the first phase.
OK, so it's really an impossible question to ask you, but I'm going to ask you anyway. Yeah. A lot of people, obviously, the most vulnerable have to be protected first. A lot of people are wondering when life can get back to normal, and that is going to depend on widespread vaccination. You know, 70% of the population probably need to be vaccinated before we can get back to some kind of normality. Beginning of the summer, end of the summer, second half of next year?
We don't know. Remember, all we have from the European Medicines Agency is they're currently reviewing 2 of the vaccines, the Pfizer vaccine, which we hope we'll get a positive from in a number of days, and then the Moderna vaccine, which they're looking to make a decision on the 12th of January. We will be looking for as much of that vaccine here as possible. And then really what we've got to do is we've got to turn to the National Public Health Emergency Team and say, OK, we have followed a strategy as a nation that has worked really well. We are the top performers in Europe on this. Now that we can vaccinate and protect the most vulnerable, can we begin to alter our strategy? That's what everyone's asking. That's what I'm asking. That's what NEFIT will be looking at. But the focus right now is let's make sure we get as much of the vaccine as possible and get those who are at risk of dying, let's call it as it is, at risk of dying or at risk of very serious illness, let's get them protected straight away.
And those people include people who aren't in long-term care but do have underlying conditions. And the opposition have been broadly supportive, as we saw in the earlier report, but they are raising questions about that because they're quite low down on the list of categories.
Yeah, the opposition have been supportive, and they are asking, I think, very reasonable questions. I would say that people with serious underlying conditions actually are still quite high up. I think we would all accept that those in long-term residential care who are older, they make over, unfortunately, that group, over half the COVID deaths that happened in the first wave come from that group. I don't think anyone would argue with that. And I don't think anyone would argue with protecting the healthcare workers who are going out every day and putting themselves at risk. Very shortly after that is people with underlying conditions. And what our experts are saying to us is, as more information comes in about each of the vaccines and which ones are more suitable for different groups, we can adjust accordingly. And really what we want to see, David, is we want to see concurrent vaccinations. So what I want to see is I want to see as much of the Pfizer vaccine in, assuming it is okayed, and then to be vaccinating people in parallel. So not just one group, but people with underlying conditions very quickly.
OK, pregnant women are being advised for the moment not to take the vaccine because it hasn't been tested. What about people with allergies? Because there were bad reactions by a couple of people in the NHS. Yeah,
there were, and my understanding is it's not my area of expertise. Obviously, we need to hear from the experts, from the likes of Dr. Nolan, who heads up the HPRA, on exactly these issues. What Dr. Nolan was explaining at the press conference today is there are always reactions to vaccines. When you're vaccinating large groups of people, there are very, very small numbers. They'll be looking at that. They'll be looking at the information that comes in from the EMA. But certainly we will follow the advice as to exactly what to do. And if there are any issues, if there are any recommendations for people with underlying conditions, they will be passed on.
OK, Health Minister Stephen Donnelly, thank you indeed for joining us.